first question we have, if a woman is visiting a Zika virus endemic area, how long should she wait to become pregnant after returning from the area? This is a great question. So, of course, a woman who is interested in becoming pregnant should discuss this with her healthcare provider. It's advised, based on the incubation period of Zika, that a woman should wait 8 weeks or so after returning before coming pregnant. It's also been asked, how long should a man wait after returning from a Zika-infected area? And that also is an 8-week period in general, but we recommend that up to 6 months, because we don't know how long Zika virus can exist in semen. The longest that we have information about to date is 64 days after illness, and so we do like to be cautious. So 6 months for men, 8 weeks for women, and use of condoms if there is a chance of infection. There is no information that breastfeeding poses a risk to infants, and we're advising the benefits of breastfeeding outweigh the risks, and so we advise breastfeeding women to proceed. Are the calcifications able to be seen in utero? So these are the intracranial calcifications in a fetus. And yes, they are. This becomes more evident later in the pregnancy. As you may know, the routine ultrasound screening in pregnant women occurs about 18 to 20 weeks in any pregnancy. And so after that, at that time and afterwards are when we're most likely to see intracranial calcifications. Here's another question. Is testing of semen of men with possible exposure to Zika virus recommended? At this time, we're not recommending testing of semen. We don't have enough information to interpret the tests and aren't doing that on a widescreen basis. Is there any known association between maternal Zika virus infection and other adverse pregnancy outcomes? Well, I named a few. The ones that we are most familiar with are the brain defects. Also, there can be impairment of vision and hearing. And there are also some malformations that may occur to the extremities. We see an increased incidence of clubfoot and other such extremity deformations. If Zika virus IgM decreases after 12 weeks, what are the recommendations for pregnant women exposed more than 3 months ago if IgM is negative? If a pregnant woman was exposed more than 3 months ago, and I presume that the person asking the question means that those 3 months are during the course of the pregnancy, the woman would receive her standard ultrasound, and evaluation would go on from there. If testing is inconclusive, retesting can be done, and of course a evaluation of the child after birth is important too. Another question, are future pregnancies at risk with prenatal exposure? We are advising at this point that no, we do not have any reason to believe that future pregnancies are at risk because of a prenatal exposure for a recent pregnancy. So when we're talking about transmission between adults, we can only talk about the man at this point. We do not know if women are able to transmit the virus. And whether or not asymptomatic men can transmit, it's possible, and that's why we're recommending condom use for up to 6 months after returning from travel. Is the Zika virus rash distinctive in children? The rash is not. As I've mentioned, it can be macular or papular in either adults or children, and is an erythematous rash. How common is fever with Zika virus disease? It is true that our recent reports and historic reports about Zika virus suggest that not everyone has fever, and so it is variable. I mentioned in the pediatric cases that we've seen thus far that rash has been a consistent finding, but we're working to learn more about the natural history and presentation of the disease. Is there lifelong immunity after a recovered Zika infection? That too is not clear. I believe that we think there is, but I would have to say that we need to learn more about that situation. Have there been reports of co-infections with dengue and/or chikungunya on top of the Zika infection? I'm not sure about on top of Zika, but we know that dengue and chikungunya can occur together, can be co-infections. We think this happens rarely, and we think it's likely to happen rarely with Zika infection. So I would say possible, but we don't have a lot to report on that just yet. Is it possible for a patient with a history of chikungunya virus to contract Zika virus and develop symptoms? Yes, absolutely, and hence our concern. As I mentioned, it may be a little more complicated in interpreting test results when someone has previously been infected or been vaccinated against one of the other flaviviruses. So that's why, because our tests are new and because this can be a complex situation to navigate the interpretation of these tests, that's why we advise healthcare providers to consult with health departments to interpret the results. Other than age, is there any way to predict those who may develop GBS? In general, across all causes of GPS, I think that's a difficult prediction to make. So no, we don't have good information about who may develop GBS, either in GBS in general or in this association with Zika virus disease. As I mentioned, infection is a common insult that may lead to Guillain-Barré syndrome. Someone is wondering if we may miss cases if clinicians rely on the presence or history of fever prior to testing. It's true that it is quite likely that we're missing cases, not only because the signs and symptoms may be inconsistent with what people anticipate, but also because some people are infected and asymptomatic. So as we learn more about the illness and revise our case definition for the illness, I hope we'll be able to zero in more closely on this. But as many other illnesses, the signs and symptoms can be inconsistent. But fever, rash, and conjunctivitis is more prominent in Zika virus as compared to chikungunya or dengue. What are the predictions for locally acquired infection rates for this summer with expanding territory of these species of mosquitoes? That's a great question. We do anticipate that we will see some locally acquired spread in the continental U.S. For this reason, we're advising that people use, in areas where active transmission is ongoing, we're advising that people use, when returning, use insect repellent for a week after disease and for 3 weeks after returning. We're trying to limit the transmission of the virus from ill people or people who are carrying the virus into the U.S. domestic mosquito population. Has it been proved that there is transmission by Aedes albopictus in addition to Aedes aegypti mosquitoes? Because both of these mosquitoes are able to transmit other flaviviruses, it's believed that albopictus would possibly do that as well. I don't know if it has been proven. but so much is similar about the two mosquitoes and the other viruses that they can transmit. What mosquito control measures are being planned or are in place? This is a great question. So we talked a lot about what people can do personally to address or to prevent mosquito bites. And as far as mosquito control, a lot of the effort there relies very closely on water sources around the home. These mosquitoes stay very close to humans. They prefer to feed on humans. They can live very well inside and lay eggs in very tiny water. And their eggs can survive dry conditions as well. So it's very challenging to address this. Some of the mosquito control programs that are possible are treating individual homes. In Puerto Rico, there's an effort to treat the homes of pregnant women. And then wider mosquito control measures are also being considered. But because these mosquitoes live so closely around the home environment, individual citizens can have a lot of impact and control about what's happening in their immediate environment. What is being done about blood transfusion, and how long before being allowed to donate blood? This is a great question. In Puerto Rico, the FDA had issued some advisories about how to manage blood transfusion because transmission is happening locally. And so different blood products are being treated, and blood products are being supplied to the area. As far as I know, I don't know about limitations of how long before someone is allowed to donate blood, but I would think it would be very similar to the recommendations that we're making about pregnancy prevention and precautions for sexual transmission.